Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. And again, if you have questions, call us. We're at 800-848-9222, 800-848-9222. My name's Dr. Lederman, and we're talking about cases and news that may make your life better. We hope it will make your life better and learn more about how doctors work and how doctors think or don't think and what confronts other people in their health care. It may confront you. And by listening to the show, you may be better armed and prepared to deal with doctors and the healthcare system and maybe with life itself. So I have a very interesting man I wanted to talk about. Actually, I think he's one of the most interesting people that I've encountered for the challenges that he faces. This is a man, 81 years old, from Trinidad. He came to me just on Thursday. Now, this man had kidney cancer in 1995. He went to a big cancer hospital. His cancer then was just pretty small. It was about 2 centimeters. But at the cancer hospital, they removed his entire kidney. So the kidney is pretty big. The cancer was 2 centimeters. There certainly were other methods of treatment then, including removing only part of the kidney or treatment localized to just one part. But he had the whole kidney removed. I'm sure he didn't choose that. He chose it, but maybe he wasn't given any options. It's hard to choose options if you're not given any options. Now, the next year he had prostate cancer, and he received 8 weeks of radiation there. And by 2007, so 10 years later, the cancer came back in the other kidney, and the prostate cancer came back. So he went to a big cancer hospital. I know a lot of people feel, wow, I'm so lucky to be in this cancer hospital. But in fact, he had his kidney removed. It didn't work. He had radiation there for his prostate. That didn't work. He's still feeling happy, and he's at that cancer hospital. He started hormonal therapy. In 2007, they removed half of his other kidney. So now he's down to a quarter of his kidney capacity, which is, by the way, enough. For most of us, a half of one kidney is enough to live on. So he's enough to live on, and his blood tests show that his half of kidney is supporting his body. He's urinating okay, he's feeling okay, but last winter he had back pain, and the kidney cancer has come back again. Now this time it came back to the lymph nodes. So he's got stage 4 kidney cancer, and he went to this cancer hospital again. That's where he gets all his care. Everything's done. I looked through the list of things that were done there. Wow, everything, every lump and bump. He had surgery at this cancer hospital, not in a doctor's office. His weight has dropped by 20 pounds in the last year. They removed the lymph nodes using robotic surgery. And now his cancer, even then actually, his cancer had come back in the kidney. So in the half of the kidney that's left, remember they removed one full kidney before, they removed half of a kidney more recently, then the cancer spread, so he has stage 4 cancer, and now they're telling him they want to remove even that half of kidney and put him on dialysis, even when he has metastatic kidney cancer, and they want to do it without doing any scanning to see exactly where the cancer is in more than 10 months. Now, can you believe this one? He's an 81-year-old man. He's lost a kidney and a half. The treatment didn't work. It spread to the lymph nodes, so it's metastatic, and they want to remove the kidney and put him on dialysis, and the treatment they had for prostate didn't work either. Nothing they've done has worked, and he keeps on going there. And finally, he hears about us, and he comes in this week, and finally he understands that there's other options available, that he could have kept the kidney and had radiosurgery. He could have kept the other half of kidney and had radiosurgery. He could have had those lymph nodes treated with radiosurgery. Our success rate for kidney cancer is 90%, where we aim the beam. And if you look at our data, and it's a booklet that we can send you if you call us during the work week, our data for high-risk prostate cancer, and it's, I'll direct you exactly to the page. Our work versus their work shows a 90% improvement. 90% more people, high risk, are improved if they come to us. Here's the data. It is figure 10, page 8 of our prostate booklet for unfavorable risk. If he had radiation there, and he did have it, the success rate is 35% for his prostate cancer. Had he come to us for our seeds and treatment in the stereotactic frame, the success rate is 67%, 91% better. So, what's the meaning of this all? Well, number one, even if you're going to the big cancer hospital, or maybe especially if you're going to the cancer hospital, you might want to look at our data first. It's the data. It's how the treatment is. Those bricks and the big building that's 30 stories high, they don't treat you. What treats you is a doctor, his treatment, her treatment, and you. And are you getting the best treatment? Do you want to know the options beforehand? Don't you think he would have liked to know that if he came to us, he would have had a 91% better chance of being cancer-free for his prostate than just the 35% chance he had there? Wouldn't you want to know that? Do you think he was told that? That if you go to Dr. Lederman at Radiosurgery New York, you have a 91% better chance of being cancer-free for your prostate? He wasn't told that. And he wasn't told that there's options for the kidney, that you don't have to remove the kidney. And this man with stage 4 kidney cancer, there are options to treat the kidney cancer wherever it is, whether it's in the lung or the liver or the lymph node or the spleen or the adrenal or the bone or the brain or wherever, there are options. And those options, while you can have surgery if you want, you are the president of the United States of your body. You get to choose. And if you go to anywhere else, you are still the boss of your body. You are in charge of your body. And you can listen, just like you're president of the United States. You listen to your advisors, and if you agree with your advisors, great. And if you disagree with your advisors, then, like the president of the United States, you get a different advisor, an advisor who spends time with you, an advisor who listens to you, an advisor who shares philosophy with you. Maybe you want to have your kidney removed. Great, then you should go there. Maybe you want to keep your kidney and stay off dialysis and avoid radical invasive surgery. Then you might want to come to Radiosurgery New York, because that's our philosophy, trying to keep your body intact, trying to keep your healthy organs. We think for this 81-year-old man to have a removal of his kidney, put him on dialysis, even though he has metastatic cancer, seems ludicrous to me. What do you think about that? I would like to have your response. If you want to give me a call today or during the week, I'd like to hear what you think about how different the treatment is depending on where you go. So for us, that's why we brought radiosurgery to America. We were the first to do stereotactic body non-invasive radiosurgery, which is pinpoint treatment for cancers anywhere in the body. And now you can see why. With this man, you can easily see why. All right, if you have other questions, please call me. I'm at 800-848-9222. Bruce is here with me, taking your calls. We are live. You can pinch us right in the heart of Manhattan. And I want to talk about another man who came to us with a Gleason 7 PSA 5.76. He's a 49-year-old black man. And why do I talk about black men? Because the mortality rate, the death rate in the black community is 2 times what it is in the white community. Why? Well, there's lots of reasons why. Probably the biggest reason why is delay of therapy. So Gleason is how the cancer appears under the microscope. The PSA is the blood test. It tells us how that protein in a higher PSA is indicative of a greater chance of having prostate cancer and higher risk. So he's intermediate risk because his Gleason score is more than 6. His PSA is low, so he's intermediate risk. He's fully active, works every day. He's a bus driver in New York City. His weight is 215 pounds. He's 5'5". He wants to be cured. He wants to keep his sex life together. He's a very loyal man. He served 10 years in the Marine Corps. He's working in New York City buses now. He's a strong, healthy man, and he wants to have the best chance with us for Gleason 7. The chance of success is 90%, being cancer-free. With surgery, even if they remove the prostate, it's only 60%. Why is that? Why is it, if the cancer is localized and they remove the prostate, the success rate is only 60%? But if we treat the patient, we leave their prostate in, we avoid radical surgery, hit the cancer in the prostate, our success rate's 90%. I bet you'd like to know why that is. And probably because we don't handle the prostate. We don't touch the prostate. We're sending beams and treatment in from the outside. And we have lots of data over more than 20 years. In fact, we just had another paper accepted for publication, and we follow our data. So if you have prostate cancer and you're interested in avoiding radical surgery, you're interested in having a higher success rate than with radical surgery, if you're interested in keeping your sex life and your urinary life, so I guess that's most all men, you might want to give us a call and talk about how we have a better chance of curing the cancer than with surgery, with a better quality of life, urinary life, and sexual life. We're going to stop for just a moment and hear from our sponsor. This is Dr. Lederman from Radiosurgery New York. We're live at the WABC studios. You can call us if you wish, or just sit back and listen. So here we go, and talk back in a minute. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated,